Okay, perfect. So today's session is about kidney disease. So we're going to be talking about kidney disease and kidney transplants, prevention and treatment options. And we have three lovely presenters here with us tonight. First, we have Miss Jenan Johnson. Jenan began her journey in 2017 when she started searching for a living kidney donor. She was only given 4 years to live, and with the deceased waiting list, so the waiting list for deceased donor transplant, being 6 to 8 years long at that time was not on her side. One day, her mother suggested that she be placed in a Toronto place an ad in Toronto major newspaper asking anybody who was willing to get tested and possibly be her kidney donor. After having the plea published in Now magazine and trending on social media, an amazing woman named Christy reached out, start stating that she would like to get tested and try to be Jenen's living kidney donor. On March 27, 2018, Jenan was blessed to receive a second chance at life through an amazing generosity of Christie's kidney donation. Since her surgery, Jenan became an active member of the Volunteer Advisory Committee at the Center for Living Organ Donation, the Action Project, and the host of the Green Table Talk on the African, Caribbean, and Black Organ Health YouTube channel. She strongly believes that she has been blessed with the gift of life at a second chance through organ donation, and that the least she can do is give back in any way she can. So we'll start with her, and she'll share her journey with us on her kidney disease, her experiences with dialysis and kidney transplant. Thank you.
Thank you. Well, first of all, good evening, everyone, and thank you very much for allowing me to join this amazing panel. I'm sure it's going to be very educational. Like Devron said, my name is Janine Johnson, and I was diagnosed with kidney disease. But before that, this whole thing originally started way back in 1989, or 1989, sorry. And so, no, 1999, my apologies. Got my years mixed up, 1999. At that time, I was in my 20s, early 20s, and living life, just started college, not too long ago, living the college life, parties, having fun, hanging out with my friends. Everything was great. Life was good until all of a sudden I noticed that every time I woke up the following morning, my eyes was extremely puffy. It looked like I didn't even sleep, honestly. It just like extremely puffy. I felt fine. I didn't feel tired, but I just had this puffy look to my face, my eyes. So I went to my doctor one day and I explained to him that I don't know what this was causing this. So my doctor then suggested, which he wasn't a very good doctor, he suggested that I just took Tylenol and that would just help reduce the swelling and inflammation. I, of course, that didn't sit well with me. I didn't like that diagnosis. So I continued. I went to another doctor, and that doctor then said, okay, and he sat down and he asked me several different questions. Do you feel tired? Do you eat a lot of fatty foods, greasy foods? He went through like a gambit of questions. Then we started with the blood work. And then he referred me to a nephrologist, and I had no idea what a nephrologist is. Never heard of a nephrologist in my life. But he explained to me that this particular doctor will then go further in depth of what we've already started in terms of blood work and asking me more questions. And so I said, okay, at this point in time, I'm just thinking it's something simple. They're probably just going to give me a pill. It'll take away whatever the problem is. And I'll just go back to my life, go back to college, go back to doing what I normally do. Unfortunately, after further testing and looking into it further, more questions, we found out that I actually have lupus. And lupus is an autoimmune disease. And it's basically, it's a disease that takes your immune system and turns it against itself. And it starts attacking any and everything in its wake. And unfortunately, one of the things that it was attacking for me was my kidneys. At that time, I was not in kidney failure, but my doctor at that time explained to me that eventually I will need to get a kidney transplant. At that time, I'm listening, but it's not registering. I'm not really fully taking in what he's telling me. I'm thinking, you know what? It'll fix itself. Now, at this point, I don't know anything about kidney disease. I don't know anything about kidney failure. I don't even know anything about lupus, what I've just been diagnosed with. So I said, you know what? I'll look into it, but it's okay. I'll be fine. It's going to fix itself. I'll just change the way that I'm eating. I'll stop going to bed so late. I'll stop staying up so late. I'll stop, going out and having fun in the clubs. I'll just change the way that I'm doing things, just dial it back a bit, and it'll be fine. My kidneys are fine. There's nothing wrong. So I continue doing what I was doing. I ate less, greasy foods, and I started changing the way I was doing things. But unfortunately, that's not the case. Kidney disease cannot be fixed by just, changing the way we eat, eating more salads and drinking shakes, healthy shakes with protein and what have you. There has to be an actual medical intervention. And I quickly realized that this is what I needed. So I was seeing several doctors at the time. My nephrologist, I had a host of doctors, nurses, and everybody was, chiming in to help fix the situation that I was going through. And it was a lot. It was a lot to take in, but of course I had my mother was there. I had great family support, and we're a strong believer in prayers. So every time I had a doctor's appointment, we would pray prior to the appointment. My mom, strong believer in prayers, she would pray religiously. So we knew the situation was going to be fixed, but we just didn't know how the situation was going to be fixed. We figured, you know what? Let's just leave it in the doctor's hands, leave it in God's hands. It'll all be taken care of. I'll do my part, and the doctors will do their part. God will do his part. Everything will work out. But then it didn't really work out that way. Then I found out, okay, you've got to go on dialysis. I didn't set myself up for this reality that I needed that type of help where they'd have to do dialysis and have my blood run through a machine, filtered through a machine 3 times a week, 4 hours a day, 3 to 4 hours a day. I never expected all of this to happen. And that just hit me like a ton of bricks. So now I'm told I need to do dialysis. They've educated me on dialysis, how this process works. It seems scary, but don't worry, Janine, you'll be fine. You're gonna have a bunch of nurses around you. They'll be able to help you through this process. And they did. It was a great team at Toronto General Hospital, and they did help me through the process. But ultimately, I needed a kidney. That's the only thing that could really fix my situation. There is a deceased list, as Devron mentioned. There's a deceased donor list, but the list at that point in time was 6 to 8 years long, and I was only given 4 years to live. At this time as well, I have a 12-year-old daughter. And so based on the math, I'm not going to be here for my daughter's 16th birthday. And if I am here, what good of a mother would I be at that point? Would I be weak? Would I be frail? Would I be laying in a hospital bed? What would my state be at this point in time? All of this stuff is going through my mind. So I figured, you know what? I have 2 options. I could sit here, wallow, be sad, and just give up, or do something. So one day, my mother thinks best in water. She's a water sign, so she thinks best in water. So one day she came out of the shower and she called me, Janine, I have an idea. I know how we're gonna fix this. Okay, what's this idea, Mom? It came to me, God said, you need to put an ad in the newspaper. Okay, how are we gonna go about doing this? She said, I don't know, but that's the message. We need to put an ad in the newspaper. So I started calling up different newspapers. I'm still doing dialysis. Just a little side note, the dialysis that I was doing in the hospital, the hemodialysis, wasn't working anymore because the line that they've placed in my neck fell out several times. So now they've said, let's try doing peritoneal dialysis. So at this point in time, now I'm doing dialysis at home. And peritoneal dialysis is literally where you just take a fluid and you just place it in, you connect yourself to a bag, and the fluid, gets placed inside of you in your peritoneal cavity, and you let it sit there. You just go about your day, you go to work, what have you, and you go about your day, and you have to drain that fluid back out X amount of hours later. And that was actually a little bit more fitting for me because I was still working, I'm still a mom, I'm still taking my daughter to dance classes, I'm still a wife, I'm still cooking, I'm still doing everything that a woman would be doing in that state, right? I'm still doing it. So that seemed to work out better for me in the end, as opposed to spending 3-4 hours in a hospital 3 days a week. So this peritoneal was actually better for me. So that's what I ended up doing in terms of dialysis. But in the end, I still need this kidney. The wait list, as I said, it was 6 to 8 years long. My mom has this idea, let's put an ad in the newspaper. So I started calling up different newspapers. I'm calling up the Toronto Star, I'm calling up the Sun, I'm calling all these different, called the Globe and Mail, speaking to people on the phone, explaining to them, listen, how do I go about putting an ad in the newspaper, just trying to reach someone who's reading your paper and asking them if they're willing to be tested to be a donor for myself and help save my life? How would I go about doing that? And everybody shut me down. All of the newspapers shut me down. They said, you know what? we're sorry the situation that you're going through, but unfortunately we can't do it, because they thought I was trying to do some type of organ harvesting. So they thought I was trying to take someone's organ and sell it on the black market. They thought I was trying to just do illegal things with someone's organ. And even though I tried to plead and explain to them, no, 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 this is completely legit. This is for me. There's actual channels that, you know, whoever wants to donate, there's actual channels for them to go through, legitimate channels through the hospital. I have the website, and I just plead my case, and they all said no. So I'm feeling helpless at this point. I'm thinking, how is this really going to work? And so one day I said, you know what? Let me try Now Magazine. It's a little local magazine. It doesn't have as far of a reach at that time. It doesn't have as far of a reach as the Toronto Star or the Globe or what have you. But you know what? Let me try this magazine as well and see what happens. So I reached out, spoke to a lovely woman. Her name is Margaret. Explained to her my situation. And I said, I'm trying to reach someone who's willing to get tested and see if they could be my life-saving kidney donor. She said, sure. What do we need to do? I said, oh, and I wasn't expecting that response. So I said, oh, okay, well, I've written up a little blurb of what I'm looking for, the blood type. I can send it to you, and then you just tell me how much it would cost to put the ad in there. And she said, yeah, sure, we could run it for a week, 2 weeks. How long would you like? And it just seemed so natural to her. She didn't put up a fuss. She didn't say no. It was just, sure, just send it to me. We can put it in the paper by Thursday. Very, very nice woman. I said, okay, this sounds promising. I sent it out to her. She put it in the newspaper. And by Thursday, it was up and running. And by Friday, there were so many people that was reaching out, trying to help save my life. Hey, I'm an O blood type. What do I need to do? So many people kept reaching out. And I was just overwhelmed by all of the generosity of everyone that's trying to save my life. So eventually, there's this amazing woman named Christy Nolan. She saw the ad. We also had it on Facebook as well. So I had this posted in my Facebook page and shared it with all of my friends on Facebook. My cousin took the ad and she had it on her Facebook page. And that's where Christy saw this ad asking for someone that's willing to be tested. She reached out to my cousin and she said, hey, I'm an O donor. I'm an O blood type. What do I need to do? And then my cousin said, yeah, reach out to Janine directly. She'll tell you exactly what to do. She reached out to me, and it was mind-blowing to me because I spoke to her, let's just say at 2:00. And by 4:00, she reached back out to me. She said, okay, I filled out the forms. Everything's done. And that was mind-blowing to me because it's a long form. There's a lot of questions on there. And some people, like some of the people that did reach out to me, they said, yeah, I'll take care. I'll do it. But I know, you know what, because it's so lengthy, some people might just be turned off by that and decide, you know what, they're asking too many evasive questions, and they just kind of back away from the whole situation. And I don't hold anything against them for it. I get it. They don't owe me anything, so I get it. But to see Christy actually go through with it, and she said she saw my story and she was just moved by it. She said, you know what, I'm going to go through with this and let's see what happens. So she went ahead, she filled out the forms, and I was just shocked. And then I said, you know what, we need to meet. Regardless if you're my donor or not, regardless if you saved my life or not, I need to meet you in face to face, so I could just thank you in person, because you really didn't have to. You didn't have to. So we met up, and she's a lovely young woman. She's a yoga instructor. She has her head on straight. She goes to the church that my cousin goes to, and we just blended, we just clicked. We found out our birthdays are like days apart. It was just fate. So she went through the testing process because the doctors called her and said, you know what, you could possibly be Janine's donor, so let's just get you tested. So she went through the testing process, went through all the blood work and did everything that she needed to do. And months later, she got the call letting her know that she is a match, and if she wants to still proceed with donating her kidney to me. She said, yes, what do you even think about it? No hesitation, 100% yes. So she went ahead, and then I got the call from the hospital. So they called her first, just in case she changed her mind, because that's happened before as well, not with myself, but in general, sometimes that could happen. And so they asked her first. She said, yes, 100%. Then they reached out to me, and they told me, we have good news. And this is the call, as they say, because this is the call that saves your life. So when I saw their number, I personally thought it was bad news. I thought it was bad news. And when they told me that Christy is a match and she's still willing to donate her kidney, the emotions, the joy, the tears, the laughter, everything just hits all at once. And I remember calling my mom, she was at work, and I told her good news that Christy was a donor. And she said, "Thank you, Jesus. Thank you, Jesus." And she was so happy. People at work thought she was losing it because she was just standing there in the middle of work and just like crying. And people didn't know what was going on with my mom. And so we had to decide on a date, both myself and Christy. And we decided March 27th would be the day that she donates her kidney and saves my life. March 27th came along, the surgery went excellent. And now here I am sharing my story with you, letting you know that, you know what, anything is possible. Anything is possible. And all it takes is faith, courage, determination, and just belief. Like once you put your faith into someone, I chose to put my faith in God, and I knew that He was going to bring me through this. And so did my mom. And through all the ups and downs, like this whole process, there's nausea, there's vomiting, there's headaches, there's weakness. Plus, I had to fight back with the lupus because lupus has a tendency for some people, for me, it made my joints really stiff. So the stiff joints, trying to, loosen them up, I would just ride on my stationary bike. Sometimes it kicks in at 2 o'clock in the morning. I'm sleeping, and all of a sudden I just like seize up, and I have to like roll out of bed and just waddle over to my stationary bike, riding and pedaling on this bike, just trying to loosen up my joints at 2 o'clock in the morning, trying to loosen up my joints because it's painful. It's extremely painful. And so after all of this, March 27th, 2018, I received my kidney transplant. And I decided at that point, this right here, what I'm doing is something that I need to do. I need to reach out to others, let them know how important it is to donate, let them realize that it is something that's within all of us to do, let them realize that it is possible to save someone's life. We all have that within us. And if it wasn't for the generosity of Christy, I, for 100%, wouldn't be here right now sharing this story with you. So that is my story, and that's my journey.
Thank you so much for sharing, Christy. So now we have 10 minutes. So if anybody from the audience wants to ask Christy some questions about her journey and her experience, feel free to put in the chat or raise your hand and ask any question.
Actually, it's Janine. Christy was the beautiful woman that saved my life.
Janine, sorry. So I
It's
was thinking
okay.
so much about Christy and her lovely
I know.
gift that she got. She was sorry, Janine. So sorry.
It's okay. It's okay. It's not a bad name, so it's okay. There's someone
Yes, I
I
see a hand raised.
So, Janine, I'm assuming that other members of your family tested, but they weren't a match for you?
That is correct. Actually, my mom was a match, but they couldn't use my mom's organ because of her age. So they said, and my mom, she tried so hard. She said to the doctors, "Listen, it's okay. I'll sign a waiver if I have to. I'll sign a waiver saying if anything happens to me, you are not held responsible." But unfortunately, that's not something that they could do. So because of her age, she wasn't able to donate. But she's the only one that was a match. Everybody else did. My husband tried, my cousin's husband tried. So many people tried. Friends of mine came out, but no, but the only person who was a match was my mama. Because of the age, they wouldn't let her do it. Does anybody else have any other questions? Don't be
Janine, I
shy.
didn't hear the first, you said you have lupus. Did you have lupus affected your kidneys, right?
Yes. So because of lupus turns my immune system or turns the person's immune system against themselves, like against themselves. So my immune system was attacking my kidneys, and fortunately, it didn't attack anything else. My immune system didn't turn against my liver or anything of the sort. But yes, it did cause damage to my kidneys, and they placed me on medication to help counteract that. So at this point in time, I do have my brand new kidney, but because of all the meds that I'm on, it's actually kept my lupus at bay. And so it's not, turning against my other organs, thank God, at this point in time. So that was my situation. It was the lupus that started this whole thing. But I always say that if it wasn't for that situation, I wouldn't be able to speak with you guys today. I wouldn't be here sharing my story and my journey with anyone because I wouldn't have gone through that. So I've always said that if this is the end result where I get to live and share my story and try to inspire with my story, I would do it all over again in a heartbeat because the end result is beautiful. I get to speak to amazing people such as yourself and get to share my story.
Thank you.
You're welcome.
Any other questions for Janine? Okay, so if not, we'll move on to the next presenter. Janine, will you be staying online with us? Yeah, so if you have any other questions later on, she'll be here to answer those questions. So our next presenter today is Dr. Bourne Auguste. He is going to be talking to us about the risk of kidney disease, progression, prevention, and treatment. So he's a nephrologist at Sunnybrook Health Sciences Center and an assistant professor in the Department of Medicine with a job description of clinician in quality and innovation. He currently serves as the co-director for the certificate program at the Center of Quality Improvement and Patient Safety out of the University of Toronto. He's also the co-chair for the Ontario Renal Network, Black Health and Chronic Kidney Diseases Working Group. His main interests include developing innovative tools for home dialysis training and improving the focus on equity-based care in quality improvement.
Thank you for that introduction, and thank you so much for sharing that story, Janine. Very powerful, and some of it resonated with me, and I imagine what you went through in terms of home dialysis and peritoneal dialysis, because that's actually one of my areas of focus. I have a lot of patients who are on peritoneal dialysis, and it brings me great joy actually when they do get kidney transplants. But it's thank you so much for sharing your story. So I know what the struggle must have been like for you, and it's important for other people to hear what the experience is like and just to inform them about managing kidney disease. So I'm going to share, I have some slides prepared, so I'm just going to share them. Give me 1 second here. And let me try to share my screen. Screen 2, share. And all right, can you see my slides? Excellent. All right, so I'm just going to give a quick overview of kidney disease and strategies in terms of how we can improve the health of within the Black population. In terms of my positionality statement, I'm a Black man who was born in the Caribbean, migrated to Canada back in 2003. As mentioned in the introduction that Devon provided for me, I currently work as a nephrologist, kidney specialist at Sunnybrook Hospital with a focus on home dialysis mostly. I have no conflicts of interest to declare that are relevant for today's talk. And the quick objectives today we'll talk about is review what exactly is kidney disease, review and discuss some common causes of kidney disease, particularly within the Black population. We'll talk about some causes of high rates of kidney disease within the Black population, and then review some strategies that could help increase not only awareness, but the management and treatment of kidney disease as well. So what did the kidneys do? Sometimes we hear a lot of things. You're like, just make pee. It does a little bit more than that. It filters actually about 150 to 200 liters of blood per day. So quite a lot of blood is filtered by the kidneys on a daily basis. And the toxins tend to be removed, toxins and fluid in the form of urine. So within that urine, there are toxins, and the fluid in terms of the volume of the urine that we see is what's removed from the body as well. The kidneys also, believe it or not, play an important role in regulating and controlling blood pressure. It also plays an important role in producing a blood hormone in the body called erythropoietin, which helps regulate hemoglobin levels in the body. So sometimes when kidney disease advances, people might have a symptom of fatigue as one symptom that they might endorse, because the hemoglobin levels may reduce as a result of the reduced production of that hormone in the body. As you can see here from this graphic, as I said, you make urine, but you also remove some toxins in the body as well as fluid from the removal of the urine. So what is kidney disease? And this is essentially just this is essentially a distinction or definition that we use as kidney doctors and specialists to define what it is, but it's just an abnormality in terms of kidney function or structure. And I know Janine made a reference to lupus. Many disorders and diseases can affect the kidney function. Diabetes and hypertension is one of them, but also autoimmune conditions as well. Lupus is in that category. But this actually goes beyond the scope of today's discussion. But I just wanted to give you a general overview in that when you have decreased filtration capacity, when the kidney is not filtering well, that it can also be defined as kidney disease. Or if you're born with some condition that could affect the kidney function overall, that can also be defined as kidney disease as well. And the way kidney disease progresses can vary between individuals. So somebody can go down like this really fast. Somebody can go down a bit, slow down, and then dramatic decline. So there are changes in terms of how kidney disease is. It's not one size fits all. There are variations in terms of how the kidney function can worsen over time. But the main causes we should be aware of, particularly in Canada and within the Black population, is diabetes is one of them. So cardiovascular disease is a leading cause of death amongst many Black Canadians, and the rates of diabetes are also and hypertension continuing to increase dramatically for a variety of reasons. Social determinants play an important role in that as well, and we'll actually discuss and delve into that a bit more in the subsequent slides. As I mentioned, so risk factors for kidney disease, high blood pressure is one, diabetes, as well as smoking. So some people believe that smoking might just only affect your lungs, but smoking can also have a significant impact in cardiovascular disease. It can also have a significant impact on overall kidney function, and could be a factor that could lead to worsening kidney disease over time if somebody has a significant smoking history. And kidney disease is not just isolated to a Canadian or North American issue. It's actually quite significant around the globe. And we see high rates of kidney disease, mostly in developing countries for a variety of reasons, due to a predominance or high levels of diabetes in these countries, lack of appropriate access to care, as well as different factors that lead to the progression of kidney disease in various aspects of the world. So it's very common in Canada, and we'll talk about this now. So observational data or studies and research studies that have looked at this actually showed from about 5 Canadian provinces, 71.9 individuals per every 1,000. So you look at 1,000 people, 71 out of that 1,000 will have kidney disease. And there's variations in terms of where you are in Canada, and that kind of makes sense. So people in the rural settings tend to have essentially high rates of kidney disease. It could be related to the fact that they don't have access to primary care providers to monitor their diabetes and care for their hypertension, or even just see a kidney doctor or a specialist just at baseline. In the urban setting, so like downtown Toronto and different areas like that, they tend to be a slightly lower rate compared to the rural areas. That may be to the fact that you might have access to care. Might be able to essentially go to a walk-in clinic or have a family doctor to follow you up and prevent you from getting progression of your kidney disease. So you're more connected to healthcare resources in such settings. But people who have chronic conditions, as I mentioned, right? So the diabetes, hypertension, smoking, cardiovascular disease, these are the individuals that have high risk of kidney disease. So you look at that. So that's actually, when you do the math here, the quick math, that's almost 28%, right? So that's quite a significant amount of individuals who have these conditions tend to have a higher risk or actually have higher prevalence of kidney disease. So what about the Black population? There are higher rates of kidney disease in the Black population relative to non-Black individuals in Canada due to the higher rates of diabetes that I mentioned, cardiovascular disease, and high blood pressure. And also, we have data that actually shows that perhaps a delay in access to care might be a driver here. So the Black population in Canada accounts for about 4.1% of the total population. Yet our prevalence in terms of kidney disease is 7.4%, right? So almost a significant increase in terms of the amount of people with CKD and requiring dialysis is quite substantial in Canada. So that actually should raise some concerns as to why we only account for 4.1% of the population, yet still up to 7% of the population that is on dialysis or has CKD is Black. So what might be accounting for that discrepancy? And I kind of touched on that a bit earlier on. So social determinants of health are important. What are social determinants of health? It's your ability to essentially access care for a variety of reasons and things that help you, have appropriate well-being in life. And there are many things that actually can affect that. Your economic stability, essentially your ability to have access and quality care within your particular environment, access to essentially care within your neighborhood. Some of these things can also be related to, health behaviors, access to essentially income and support, and things along those lines can also affect that. But you might say, well, okay, that's important, but what else could be driving that as well? And there's been obviously a lot of talk around this in terms of the impact that racism and the interaction in terms of how medicine and racism actually has significant interplay. So racism itself can actually negatively impact health in so many ways. Stress can lead to stress caused by discrimination can also have an effect on your kidneys. And the next slide I actually have will show that as well. Differences in terms of the access to care can also lead to poor outcomes from a kidney disease perspective, as well as it can also have your impact in terms of how you make decisions about your care. So all of these things play an important role that we need to be aware of. And sometimes racism is not essentially isolated from that perspective in terms of the impact of kidney disease care. And as I pointed out, so we have social determinants of health that could essentially lead to stressors. And those stressors can also impact our blood pressure, which in turn can also impact the effect that it can have on a kidney. It can also impact our blood glucose control. So if, for example, if we're not able to afford and buy healthy foods or see the doctor regularly and afford our insulin, that's also going to impact the way we manage our diabetes. And if the diabetes is not managed well, it's going to affect your kidneys. So you see, it's a vicious cycle. And that's why I made the reference to the racism that might exist from a historic perspective, as well as a prevalent perspective, what's still going on, can lead to insecurities and imbalances in the access and quality of care that we receive, which in turn could also affect your kidney health, right? So it's important to be aware of those things as well. But, you know, we talk about that in terms of the impact that it can have on kidney disease, but what are some signs and symptoms that you should be aware of? So I mentioned this earlier on in terms of the basic functions of the kidney. So you make urine, you get the toxins out, you get fluid out. Oversimplified way to think of it, very simplified way to think of it. So you can imagine if you're not able to get toxins out and you're not able to get fluid out, you can either feel really tired, feel the side effects of the toxins, itchy, malaise, just not feeling well if the toxins build up in your body because you're not able to get them out. Or you might get swelling and puffiness in the leg because you're not able to get the fluid out, or shortness of breath. You know, you're not able to exercise well or walk distances, right? Puffiness in the face, your shoes feel tight. These are some symptoms that you might see actually later on. So what do you have to do when you actually have to seek medical attention is quite important. Ideally before these symptoms appear. And that's where it's important to actually have connection with a family doctor or general practitioner to identify some of the things that I mentioned. Do you have high blood pressure? Do you have diabetes? To prevent you from getting to the point where your kidneys have progressed so rapidly that you have these symptoms, right? We want to prevent you from getting to these symptoms. Because when you start to have these symptoms, we have to have discussions around how far is your kidney disease, and do we need to have a discussion around what Janine mentioned earlier related to dialysis, right? So our goal is to prevent you from ever getting there as much as possible by identifying some of these things early and prevent it from getting worse. So some of these symptoms, as I mentioned, real tiredness, extreme fatigue, nausea and vomiting as these toxins build up, right? You're not able to eat, or appetite. You might have cramps because the fluid that might be building up in some of your tissues might be causing cramps, as well as some of the toxins in the blood as well. Some people might actually pee more often, and the peeing more often might be actually a response by excess fluid in the tissues, causing you to pee a bit more as well. And dry and itchy skin could be another symptom that people might have, but that tends to be present when we really advance the late kidney disease. All right. So as I wrap up in this talk here, we want to just talk about some treatment and prevention strategies. As I mentioned, what you can do in your own volition, in your own lifestyle, is making sure you try to have a healthy diet as much as possible. Balanced diet, fruits, vegetables, as well as activity, exercise. We typically recommend essentially 30 minutes of exercise every 4 to 5 times a week in terms of physical activity. If you're smoking, consider smoking cessation, and ensuring that your weight is well managed as well. We know that high weight can be associated with increased risk for high blood pressure as well as diabetes. So these things also can affect the kidney function as well. And provided that you have a doctor or somebody who follows you, they can keep an important eye on those things to ensure that you're actually remaining stable from a kidney function perspective. These are some other important medications that people would consider, but is obviously beyond the scope of the talk today. But I think if you were to ask me from your lifestyle perspective, and patients typically ask me that, Doc, what can I do to actually help my kidneys and be better? It's not necessarily drinking tons of water. Essentially, it's ensuring that you have a healthy diet, you're physically active, you're not smoking and harming your body. You treat your body like the temple that God gave you, right? You value it, you respect it, you try to do those important things as much as possible. And if you can have a contact with a general practitioner, a family doctor, or a specialist to ensure that these things are held in high regard and managed effectively, will go a long way. And what do we do moving forward? It actually relies on part of what we're doing here today, stronger community partnership and education. So community engagement is so important. And actually, sometimes we play a lot of what we call offensive medicine. We only respond to something when it already has happened. We need to have essentially a lot more offensive medicine. We tend to practice defensive medicine, right? We try to respond to something when it's already happened. So we need to be more proactive and do more preventative medicine. And that actually stems from having stronger community support systems through obviously faith-based organizations and systems, such as the SDA today. We're having this talk today and developing some important networks to talk to people about CKD. Sometimes not talking about it, people might have their own taboos or think that this is, not something I want to talk about. Could actually do more harm than good. It's important to have open discussions about this and encouraging community-led health initiatives to support one another. So, that's why I said today, I was so happy when Janine was here available today to talk about her experiences and how we can actually access care and resources, how we can leverage things such as the Now magazine and actually put in some of these things out there. Going out there and sometimes putting things out on a limb to actually, have these discussions would go a long way to create that community system to increase awareness about kidney disease. And additionally, targeted educational program. So we talk about things like today again, which actually stems about talking about CKD and kidney disease and how we as a community can be involved and engage in preventative medicine as much as possible and emphasize much as possible the importance of early detection. You have diabetes. All right, I'm going to do something about it. I am going to make sure my diabetes is well controlled because I don't want things to progress that I have kidney disease or high blood pressure. So it's important to empower yourself and be aware of these things that could lead to advanced kidney disease early on. All right, so I think I am just at time, and I'm happy to take any questions that might be available or any comments at this point in time. Thank you for the invitation once again.
Thank you so much for that presentation. So we have some hands raised. Dorothy.
Hello, good evening. I just want to ask a question about drinking parsley water. I'm currently drinking some water here because somebody told me that if I boiled just a bunch of parsley, keep it in the fridge and just drink on the water, it purifies the kidney. So in terms of preventative measure, is this true?
Very good question, Dorothy, and thank you for sharing that with me. So as I mentioned, I grew up in the Caribbean. My dad used to do the same thing. He'd boil it on a Sunday and he'd drink the jug for the whole week.
Yes.
He would essentially have the parsley water, and I remember seeing that green water in the fridge. Obviously, I would stay away from that as a younger child. But to speak to that, I would say, and I tend to caution my patients, a lot of the herbal recommendations that have been out there. I actually, in my clinical practice, and I have a fair bit of Black patients in my practice. I've seen actually sometimes more harm than good being done with some of these herbal remedies. The reason being is that some of the stuff is not tested. Sometimes too much of it can actually lead to a bad thing, and we don't really know the evidence behind it. I know sometimes people say, well, it's always worked. It's not really caused harm from their experience or from what someone told them. Based on that, I wouldn't necessarily recommend that you do it without actually knowing the risk that it could potentially lead to. Because in some instances, I saw one instance where somebody had a lot of vitamin C, and that's been well documented, drinking oranges to help purge the kidney, and they ended up with kidney failure. So some things can actually lead to more harm than good. And if I have no evidence to essentially say this is going to work, this has not been studied in trials, they've not monitored you, they've not looked at thousands of patients, I tend to not recommend it. And that's my take. And I know sometimes people might feel, taken back about it because they've had experiences and they've been told that by trusted sources that this worked. I tend not to recommend it. And sometimes I would say it's better to essentially just do a general checkup, see where your blood pressure is, see where your blood sugar level is, and try to manage things, with either diet, weight loss, as well as medications where needed, is what I would say. Hopefully that answers your question.
So you're saying that medication is better than the herbal stuff? Is that what I'm hearing?
Yeah, so I would say that the herbal stuff, and I might get essentially pushback from that. The herbal stuff has not been tested in clinical trials and studies, right? We can try these things, but there is risk, right? There is risk that it can essentially lead to more harm to the kidneys than good. And there's no risk that it can actually lead to further protection of the kidneys, right? This has not been studied, but when we have these clinical trials and studies, usually thousands of patients, many patients have been studied for years to see how things go from there. The same way when we have treatment for diabetes, we give diabetes medications because these things have been studied in trials to show that they do good by patients, right? That's why we give the patients medications to manage their diabetes. Sometimes people say, well, I'll just fast and not do this. This can lead to more harm than good because it's not treating the underlying cause to help address some of these issues here. So I would actually say there is limited evidence or very little to say, go ahead and drink parsley to help protect your kidneys.
I could actually add to that if I could jump in for a quick second. When I was originally diagnosed and I told my friends what was going on, my close family members and friends, someone once told me as well that I should do protein shakes because that would help with my kidney situation. And of course, there's a whole bunch of myths and everything that was going on out there. Don't follow the doctor's rules. They just want to pump you full of medicine. It's just, big pharma. They work together. The pharmacy, the doctors, everybody works together. They just want to put you on all these meds. You can fix this yourself. So all you gotta do is just start taking protein shakes. So I listened and I started doing the protein shakes. Come to find out, I was doing more damage than good because my kidney was filtering all this protein and it was making making my damaged kidney work even harder because of all this extra protein that I'm pumping in there into myself. And so now my body is working 10 times harder, my kidney's working 10 times harder. And I actually believe I actually did more damage than good. And so when I told my doctor, this is what I'm doing, he said, stop, just stop. Don't do any more protein shakes. Just leave it alone. That's actually probably doing more damage than good. And I was wondering why I wasn't feeling better as well. So I'm doing these protein shakes are good for you. It can't be, bad. I'm doing it myself. I'm making it myself. It's got to be good for you. But in the end, it wasn't. It wasn't good at all. And I did the green juices and I did the celeries and I did all these different drinks and what have you. And it for myself, I can only speak for me, it didn't work. It didn't work for me at all. So sometimes it's best to actually leave it in the hands of professionals and of course take caution as well. I mean, don't just jump in, just take everything everybody says. You have to do your own research as well, right? But I just feel that that's one thing I wish I didn't do was just listen to people and listen to my friends and listen to whomever, because I may have actually done more damage than good. Just drinking all that protein drinks and protein. It wasn't smart on my part.
Thank you for sharing that. What I will say is that I tell my patients, I counsel them, I say, listen, you could try this, but I can't say it's going to work. I do have other treatment measures that say that they will work because they've been studied in trials, they've been studied in investigation. Additionally, I have tests to track, I can measure the protein measurement in your urine. I could follow your creatinine, which is a measurement of kidney function. I could follow your essentially blood pressure. I could follow your diabetes measurement, right? These things allow me to see that I have tried a medication and to see how you've responded to it by doing appropriate tests. Some of these things, the parsley water and different things along those lines, I can't test different tests to see how you respond to that, right? So I think it's important to recognize that you could try these things, but I wouldn't necessarily say that they're going to help prevent you from being on progressing in terms of kidney disease, is what I would say.
We have another hand raised, so we'll take that other question and then we'll go to Dr. Mucsi, do you have something to say on this question?
Is that my hand, Devon?
No, I will
Yes.
come.
Yes, it's your hand
I'll
now.
ask the
You
question
yeah.
and then
Yes,
come
yes,
back.
yes. Okay, perfect. Yes, your hand.
Okay, doctor, the GFR range from your medical field, is it the same or is it higher for Black patients?
Ooh, very good question. Very good question. That is a fantastic question. I love that. You opened essentially something that's passionate with me. I know I see Istvan's laughing there and Janine's nodding. So some of you may have heard essentially, I'll just try to quickly explain. So the kidney filters, as I mentioned, 200 liters of blood a day, but it's hard to catch your urine for 24 hours. You know, no one wants to walk around with a jug 24 hours all the time. So what we have done as a lab test essentially is to take your creatinine, which is a blood test, plug it into an equation and give you an estimate of what the kidney is filtrating. Recently, or I guess in the recent past, what they've done essentially is that they have made an adjustment for Black people. And that adjustment, for most instances, has resulted in a higher estimate for Black people. The reasons behind the estimate essentially go beyond essentially a reasonable time to discuss this today. But in any event, what it has led to is that sometimes delayed access to care, because they say that you're Black, your creatinine is this, therefore your kidney functions better. You don't need to see a doctor when I do the lab test. So as a result, delay in diagnosing kidney disease is going to lead to likely rapid progression of kidney disease needing dialysis, right? Because you see the doctor a lot later. But it's essentially become quite a controversial issue in the US, such that they have removed this race correction factor in the equations. So right now, I have been working, Istvan and myself have been working on this, and there is going to be a change in the province effective in the next couple weeks, couple months, as well as across the country, where we're going to remove this race correction for Black people, such that we have more equity and more equitable estimation of the kidney function. But that's a very good question. But historically, what people used to do would correct for Black people. So you multiply the equation, I believe, by 1.157, and it would essentially bump up your filtration number a little bit higher, which would mean that maybe perhaps I wouldn't refer you to a kidney doctor yet, I wouldn't give you this medication yet, or I wouldn't do this test for you yet, because you don't necessarily qualify as having kidney disease. So that's one of the important things, but that change is going to happen, where we're going to get rid of that correction, that race correction factor, because it was just wrong on so many levels.
Has it
Thank
been
you.
removed already, Dr. Mucsi, at Toronto General? Do you know?
I think the current use is complicated because we don't collect the data, so we don't really know which patient is Black and which patient is not. And of course, we don't really know what to do if someone is half Black and half Asian. So it's a very complicated issue, and it hasn't been consistently used, which is another problem, because some people may have been harmed and others may not have been harmed. So inconsistencies, inaccuracies were major concerns about this correction. And I think at UHN, they have issued a local policy to remove it. But I also know that it has been inconsistently used.
Thank you for that. Do you have another question, sis? Yes, I still see your hand up.
Sorry, I forgot to take my hand down, but there's a question, I believe, in the chat.
Yes. So there's a question in the chat. What effect does regular warm lemon water has on kidneys?
I think I would say the same thing that I would say for the parsley water, right? I will point out, though, high levels of citric acid have been documented to lead to kidney failure. That's well documented. I actually had published a paper on this where somebody actually took high levels of vitamin D, which led to toxicity and kidney failure. So vitamin D is one of them. So certain things, when you take it in high levels, can lead to problems. Citric acid, which you get in oranges, lime, these things can lead to the development of something called calcium oxalate stones. You get little kidney stones in the kidney. Those kidney stones can become problematic. It can also affect essentially your calcium levels and do other things like that, and can lead to worsening kidney function. So anything in high quantity can lead to problems. But essentially, in terms of its benefits, I can't speak to that.
So I wanted to contribute to this discussion around the herbal medicines and the use of naturopathic, because there is some discussion in the chat as well about this, and certainly in many communities, I think very universally, use of traditional medical approaches and herbal products have been quite frequent. And I think what Dr. Auguste mentioned is a major concern around this, that we don't quite know what exactly is in these herbal products, and we don't know how much. And frequently, it's not the question whether lemon water is good or bad, or parsley water is good or bad. It's really the question of how much and for whom, and also what other medications you are taking. So I think, unfortunately, we don't really know a lot about the herbal medicines. And what Dr. Auguste said, that we don't know if it will help or not. What is important in my mind, though, is that we cannot shut down the conversation about this, because many people will use these products, whether we like it or not, or whether we support it or not. And I think it is very important in transplant medicine as well, at least to know about it, and at least to have a discussion. So, okay, you are taking these medications because you need it for the blood pressure, you need it for the diabetes, you need it for the kidney transplant to prevent the rejection, or you need it for lupus. But if you're, I suggest not to use herbal products because I will not know what they do. But if you decide to do that, if you work with a naturopath or if you work with other traditional healers, please let us know what are you doing or what are you using, because then we can at least check and make sure that there's no harm and our medications will not interfere with your whatever you're doing, or your herbal products or the naturopath's product will not interfere with what we are doing, because that there are certain instances where there could be a harmful interaction. For the lemon and the parsley, I think it's also a bit of a quantity issue. A little bit of these things may be harmful, and again, some of the citrates, if there's a lot of vitamin C, a lot of citric acid, it can form kidney stones, but some citrate actually can help to prevent kidney stones. If you're drinking liquids, it can help flushing out certain things. But at the same time, you have to be careful, because even water in large quantities can be harmful depending on the situation. So I think what is important is really to maintain that dialogue and keeping everything open and have a discussion around what your preferences are, what you're doing, what you think you want to do with your health. And so let your doctor know exactly what the context is.
Thank you for that. I know we definitely, in the Caribbean, we definitely love our natural herbs and our natural treatments, but as Dr. Mucsi said, important, whatever you choose to take, whatever you choose to do, just let your doctor know, and they can communicate that with you, and you can make sure there's no interaction between what you're taking and whatever the doctor has been prescribing to you. Okay, so there was another question in the chat, but that has been answered. So we're going to move on to Dr. Mucci's presentation now, and he'll be talking to us on treatment options for kidney failure and transplant. So we've heard from Janine, we've heard now more about kidney disease and what are the causes. Now let's talk more about the failure, transplant, and dialysis. So Dr. Istvan Mucsi is a Canadian Institute of Health Research funded clinician investigator, a transplant nephrologist at the Amjera Transplant Center at the University Health Network, and Associate Professor of Medicine at the University of Toronto. His research focuses on reducing ethno-racial inequities in access to kidney transplant, and he has been collaborating with community and religious organizations to develop cultural responsive transplant education in Health Canada funded research. He has analyzed quantitative and qualitative data from 700 participants, 250 of which were from African, Caribbean, and Black communities, to better understand inequitable access to living donor kidney transplants.
Thank you very much, Devran, for the introduction, and thank you very much for the invitation, and thank you for the church for allowing us the opportunity to have this series of discussion on health. Do you see my slides? Okay. Hopefully I will be able to continue or progress the slide. So similar to Dr. Auguste, I wanted to kind of present this slide. Obviously, when we talk about health issues in certain communities, in racialized communities, in the Black community, it is important to understand where the position where I am coming from is. And I'm a white person. I'm coming from Europe. I was born in Hungary. I'm male and I'm a physician. And all this combination leads to a very privileged position, which is frequently unacknowledged and unrealized. And certainly my journey over the last 10 years or so, when I've been working with diverse communities, including Black communities around kidney health, taught me a lot and provided a lot of understanding about these privileges, which are usually unacknowledged. And also my position as a nephrologist, a specialist in kidney disease, will bias my views and thinking, sometimes for the good and sometimes for the not so good. And I think it's important to reflect on these. When we talk about the kidney failure treatments and kidney disease treatments, I wanted to pick up where actually we left, and Dr. Auguste mentioned already this the progression of kidney disease. And in a more simplified slide, I also wanted to come back to this and illustrate where kidney failure treatments come in the picture. So on this axis, I show the kidney function in percentage, which is more or less corresponds to this GFR estimation. And when your kidney function is healthy, one can say that your kidney function is about 100%. And if you have a damage to the kidney function from lupus, as in Janin's case, or diabetes or high blood pressure, your kidney function will decline eventually. And in some people, it will decline more rapidly. In some people, it will decline less quickly. One important reason to start or to pay attention to the risk of kidney disease, and Dr. Auguste mentioned all kinds of risk factors that you should be aware of, is to realize that you need to test for kidney disease, because this line here shows that kidney disease symptoms, fatigue and nausea, only start when you lost more than half of the kidney function already. And if you wait for the symptoms to appear, it's too late. Even those symptoms that Janin mentioned, the swelling of the face, the puffiness of the eye, it can be early, but frequently it only comes late. And if we recognize this early, we might be able to slow down the progression. We may not be able to go back where with the normal kidney function started, but we may be able to slow that progression down. And it is important because if you cannot slow down the progression, eventually your kidney function will become very low. And when it goes down to around 10% of normal, this is what we call kidney failure. And this is where many people, or most people, if they want to stay alive for a long time, they need kidney replacement treatment. And the kidney replacement treatment is transplant, a kidney transplant or dialysis. So it's usually when the kidney function is less than 10%. This is when the kidneys are failing. And at that point, you have quite a lot of symptoms of what Dr. Auguste mentioned. So I start with dialysis as one of the treatments for kidney failure. And it's important to acknowledge that actually dialysis is a life-saving treatment.
It's a kidney failure function.
So dialysis is a treatment, as Janin mentioned, can be done with hemodialysis in the hospital or home, or peritoneal dialysis, which is done at home. It cleans the blood and does replaces those functions that Dr. Auguste mentioned, removing the toxins, removing the extra water. But it's important to also acknowledge that it is able to replace only about 10% of the kidney function. So you start with less than 10% when you have kidney failure. The dialysis adds another 5% or so, maybe more. And so you have a little bit of kidney function left, so you're able to live. Some patients are able to even work fully, but you are compromised and limited in many ways when you're doing dialysis. as Janine mentioned, hemodialysis is done at least 3 times a week, and treatments may last between 3-4 hours to 6-8 hours a time. And so it's a lot of time, and sometimes you don't feel quite well during or after dialysis. So dialysis, again, just talking a little bit about this, can be done in 2 ways, and without going into too much technical details, the peritoneal dialysis that eventually Janine was doing before a transplant is when you have this tube in your belly and you put the liquid in to sit in your belly for hours, and then the toxins will go into this fluid and you drain it out a few times a day, or sometimes you can do this with a machine at night. And basically that replaces the function of the kidney. And when you drain out the fluid, you remove the toxins from your body. And this is how you keep your blood and your body more healthy. In hemodialysis, which is frequently done in hospitals, in dialysis units like this, where you have a lot of machines and people come in, they have needles put in their arm, or they have a line in their neck, and blood is drawn, and it's run through machines, and a filter cleans the blood. And usually you do this 3 times a week or 4 times a week. Sometimes it's more frequent. Some patients are quite fatigued. And again, this whole exercise can only replace around 10% of kidney function. Many patients feel very fatigued. They have sleep problems. They cannot eat and drink as much as they want. And there's a lot of other limitations. At the same time, dialysis can keep patients alive and in a reasonably healthy state. Kidney transplant, from a medical perspective, is a better treatment option, but it is a surgery. So kidney transplant is a surgical procedure when you take a healthy kidney from a donor and put it in a patient whose kidneys are diseased, indicated here, and this transplanted kidney will then provide a function for that recipient, for that patient, and will do the functions that the kidneys normally do. Importantly, your own kidneys, if you have kidney failure, your own kidneys will not be taken out most of the time. They will be left in place, and the new kidney comes in front of your abdomen, and it is connected to your bladder, so you will continue peeing, and this kidney will replace the kidney function. It's important to compare these 2 treatments in order to understand if you have to do this, or if someone in whom you know have to do this, and which treatment is better. What should you be doing? I saw patients who were on dialysis for 10 years. They said that they didn't want a transplant. It was a surgery. They were busy with their life. It wasn't fitting them well. Others, they say that dialysis was very limiting. They couldn't really feel well, and they wanted a transplant. So comparing these 2 treatments, the dialysis and transplants, dialysis, as I said, it's immediately available when you need it. Somehow externally with a machine, you clean the blood, but you need to spend a lot of time with dialysis, whether you do it yourself at home or whether you do it in the hospital. You don't need to take anti-rejection medications. Many patients are quite concerned about those medications. They are powerful medications. They may have side effects. And when you do dialysis, you don't need to take those anti-rejection medications. However, you still may need to take medications for blood pressure, diabetes, heart disease, whatever you may have. It does come, dialysis for most patients, it comes with very significant restriction of how much they can eat and drink, mainly drink, and what types of food they can eat. Dialysis causes limitations in other ways. If you're on hemodialysis, you cannot really travel very freely, and with peritoneal dialysis, even then it's somewhat limited. And as I mentioned, patients don't feel too well. Whereas if you have a transplant, as opposed to that 5-10% of the kidney function I mentioned, you could have up to 100% of kidney function, practically normal kidney function, even with that one kidney. You feel usually much more energy, much better sleep. eat and drink well and whatever you want. And you have a kidney which can also do the other jobs that Dr. Auguste mentioned, the production of those hormones, regulate the blood pressure. Now, most of the times, as Janet mentioned, you need to wait for a transplant, and sometimes you need to wait 6 to 8 years, and you may or may not have that much time. This is only true, though, if you're waiting for a deceased donor, because then if you're waiting for a living donor transplant, it can happen within a year or within even 6 months, depending how quickly that donor can be worked out. Comparing the living and deceased donor transplant, because as we said, you can get a kidney from a deceased or a living person. Both will provide you with one kidney that can work well and can provide 50 to 100% of kidney function. But there is this waiting time for a deceased donor kidney, and in general, the living donor kidneys last longer and they function better, and the surgery comes with less complications. Now, importantly, if you're waiting for a deceased donor transplant, you don't really need to do much other than completing your transplant workup, and the TGLN system will, the Gift of Life Network, Ontario Health will find you the donor, and you will be notified. If you want to have a living donor transplant, you or your family need to find a donor. Just as in Janet's case, she went on and to put an ad, but sometimes you just need to talk to people, or others will need to talk to people, and that's not easy. Again, comparing these two types of transplants, what does it mean in terms of life, length of life? This is based on American US data, and this is for a young person. If you're about 30 years old and you need a transplant or dialysis now, if you get a living donor transplant, because it's usually stronger and better function and longer function, you may be able to live up to 40 years. Whereas with a deceased donor transplant, illustrated with the green bar, you may be able to live around 30 years. So it's a significant difference. If you stay on dialysis, you may be able to live another 10, 15 years, or sometimes it's even shorter, as in Janet's case suggested. If you have to be on dialysis for years before you get a transplant, this gain from the transplant in terms of life years will be less by several years for all treatment options. So it is important to get a transplant as soon as possible and not to wait on dialysis if you can do that. As I mentioned, a living donor transplant could last 5-10 years longer than a deceased donor, and the function is usually better. And this is the point which is important, and we come back to Black communities here, that we know that racialized communities in Canada, but in Europe and in the US as well, are much less likely to get a transplant or a living donor transplant compared to white patients, and the reasons are very complex and multiple. In the last while, there has been an increasing awareness of the impact racism has, both on the system, how it works, and how it prefers certain groups of patients as opposed to others. And this has been driven mainly in the US, but increasingly in Canada as well. Dr. Auguste mentioned some of these. We started a project many years ago looking at the reasons for these differences between Black and white patients and other racialized patients. We had a group of investigators, partners, and patient organizations, the ACB Organ Health Group, and community organizations like the Black Health Alliance and the community health centers. And as Deborah mentioned, we collected data, both questionnaire data from about 600 patients and interviews and focus groups from about 100, 150 individuals. Not everybody was a patient. We wanted to understand kidney transplant related knowledge, because frequently it is said that one of the reasons why patients from racialized communities don't get a transplant is that they don't really know much about it. And to some extent, this is true, because when we looked at the transplant-related knowledge, we saw that white patients were more likely to be in the highest knowledge group, as this is indicated with the red, and both Black patients and Asian patients were less likely to know a lot about transplant. But in general, actually, almost half of the patients knew very little about transplant. And also importantly, when we looked at the reasons for this knowledge difference, we found that the trust issue that Black patients had with the system was mediating. So because of the mistrust they had, that's why they may not be able to understand the process as much as white patients. The other side of this story, as I said, that if you want a living donor transplant, you need to be able to talk about it, ask help. And we asked a number of questions from our participants whether they would be able to communicate their need for a kidney transplant, would allow others to talk on their behalf, or would ask the donor, a potential donor, directly. And in all of these questions, both Black patients and Asian patients said that they would rather not do this. So that's why it's important for the communities to know about kidney disease. So if you know that someone has kidney failure, if they are on dialysis, it's better if you come forward and ask them, can I be a donor for you? Do you want me to be tested? As opposed to waiting for the patient to come to ask, because it's very difficult to ask. And then in our interviews with patients and community members who did not necessarily have kidney failure, we found a number of other factors, from mistrust to lack of respect for cultural values and norms, that did influence how people felt about their care, kidney care. Now, some of the quotes, I think, illustrate these issues quite well. And this mistrust is quite prominent in the interviews. And one of the participants in the interviews mentioned that we don't believe that the system is for our best interest. And there is a degree of suspicion, and the suspicion could result in not revealing information that could be valuable. So that's why I think this open communication about the conditions and the treatments is very important. Because if you cannot talk to your provider about your health, then the treatments will not work properly. Many individuals expressed what is stated here, that when they go to see the doctors, they feel that they are neglected and they are not believed. If they complain about something, it's not really, it's dismissed frequently, or it is minimized. And so they feel that they have to advocate a bit harder and push a little bit more to get the same treatment than white patients would. And that's again important, because then if you feel like that, you may not want to go to this place. You may not want to get tested if you feel that you need to push harder. So that's why it is important to acknowledge that in these differences between white and Black patients, racism, individual and structural racism, plays an important factor. And this is a major motivation for our group to start to provide information for Black communities around kidney health and treatments. Similar to this discussion, we have this website that hopefully will provide information about this. And there are other websites that are useful. There is a patient organization, Transplant Ambassadors, who are patients who receive the transplant or donors, and they can provide firsthand information about what does it mean to get a transplant, or what does it mean to donate a kidney. And the ACB Organ Health Group created a website, a YouTube channel, and there's a lot of videos and information. And the Green Table talks that Janin is moderating about issues that patients feel relevant. I would encourage you to explore and listen to some of those stories. You can also understand and follow how to register to be a donor, as in this video, which I don't have time to show, and I will be happy to answer questions instead.
Thank you, Dr. Mucsi. Any question for Dr. Mucsi?
Question. Good evening.
Good evening.
Yeah.
How long could a person live on one kidney?
Well, if you have only one kidney, you can live a long time and you can live a healthy life. 40, 50 years or longer has been the follow-ups. The initial observations came from war injuries when people lost their kidneys in the Second World War, in the Korean Wars, and 40, 50 years later, they were still living a healthy life. There are people who are born with one kidney, and frequently their kidney function will remain stable. Of course, it is important if you donated your kidney or you lost your kidney, if you had kidney cancer maybe in one kidney and had to be removed, it is important to understand what is the best way of taking care of that one kidney. It's important to have it checked, have the kidney function checked, and have the blood pressure checked. But in general, people who donated a kidney, they live just as long as if they would if they kept their both kidneys.
Thank you.
Any other questions for Dr. Mucsi or any of our other speakers tonight?
Dr. Mucsi, thank you so much for sharing your wealth of knowledge with us. It's not a question, it's just to verify some of the findings that you mentioned, where there's a lot of mistrust among the Blacks based on, as opposed to white population, based on the survey that was done. And that's true, and that's what keeping back the Black community from seeking help. There's this mistrust, and sometimes they prefer to get natural remedies that they think will work, and then in the end it doesn't work, and then they end up with kidney failure or even death. So it's good that you have shared these important information with us, and we are very thankful for hearing this. Thank you so much.
Thank you very much. Again, as I said, I learned a lot over the last years, and my eyes have opened up. I started to ask my patients, my Black patients, if they had experienced negative interactions and racism during their journey. And pretty much almost without exception, everybody said that here or there were issues, there were racist interactions with the healthcare team. And of course, this has a long impact. And Dr. Auguste mentioned, if you have these interactions, microaggressions or open overt racism, then you're living under stress. And if you're living under stress, your diabetes, your blood pressure, your heart function, everything will be impacted. And you will be anxious when you have to go to the hospital. And of course, you will not trust people. And so it is important for the healthcare system to recognize this and make appropriate steps to try to at least open up the dialogue and try to find ways to improve trust.
Just to add on top of what Dr. Mucsi was saying, I've myself taken part in quite a few of Dr. Mucci's surveys and quite a few surveys. I keep reminding people that as soon as I had my transplant and straight out of transplant, maybe day 2, I had one of Dr. Mucci's team come into my hospital room, introduce themselves, and then Dr. Mucci came in as well. I don't know if he remembers this, but because he sees so many people, but he came in as well, introduced himself. And he essentially said he wants to help us. He wants to help the Black people. But in order to do that, he needs to know our mind frame. He needs to know our state of mind. He needs to know what we think. He wants to know if I would take part in the survey. It's about 6 to 8 months long. And all you've got to do is just be honest. That's literally what he just said. Just be honest. Let us know what you think. And right off the bat, I'm like, sure, no problem. I'll do it hands down. It didn't dawn on me, oh, what is this white man trying to do? Why is he trying to help me? And that didn't cross my mind. That the color wasn't even an option. It wasn't even an issue for me. What I saw was someone trying to help us. Because if I'm being honest, when I was going through this whole kidney failure and this whole situation, Black people weren't there to help me. Sorry to say, but they were not there to help me. I reached out to friends, not immediate friends. My family, my friends, they were there, hands down. But I reached out to different newspaper, ACB, type newspapers, African Caribbean Black newspaper. They didn't want to look at me either. I've reached out to other, Black communities. I've reached out to, well-known Black radio stations. We don't have much out there, so I'm sure you probably know what I'm talking about. They didn't want to help me. But yet still, it was white people who were more than willing to help. My donor is a white woman. And Dr. Mucsi, amazing white man, he tried to help me. He listened to what I had to say. And I would do anything for Dr. Mucsi in terms of taking part in surveys and all that stuff because he tried to help me. So we have to get out of that mind frame thinking that only we can help. We, meaning the ACB community, only we can help ourselves, because that's not always true, because there's so many myths that we need to dispel. There's so many thoughts and processes out there, oh, they just want to, they want to bring us down. The white people just want to bring us down. And I get 100% where that's coming from. I 150% understand where that mind frame is coming from. But we also have to realize there's a lot of myths that we need to dispel out there. And we can't just automatically think, oh, it's just a negative thing. It's a negative thing. They just want to bring us down. They just want to use us. They wanted this, they wanted that. Because Dr. Mucsi and his team is a prime example of that. Prime example. So we need to realize that, sometimes you have to just trust. We just have to take the time to put trust out there and realize that, hey, this might actually work. We can't just assume, oh, they don't know what they're talking about. No, it's the white people, they're trying to this, they're trying to that. Sometimes you have to trust because, hey, it's a white woman who saved my life, right? It was a white woman who came out and said, yes, let me save your life. And that was another thing. A lot of Black people said, oh, the white kidney won't work. Really? Because if last time we checked, it's a kidney. The kidney doesn't have a color type, right? So the white kidney won't work. Don't take it. They just want to bring you down. Don't take it. But it's the white kidney that's keeping me alive today. The white kidney allows me to be here with you today. So we can't always just take everything that we hear as gospel, is what I'm trying to say.
Thank you, Janine. Hayden?
Amen.
I'd like to build off Janine's point in terms of the importance of allyship, in terms of, I understand that part of the ACB community, including myself, it can feel quite isolating sometimes. So being able to incorporate into allyship is very important. I was just wondering, Dr. Mucsi, in your experiences understanding the mistrust in the healthcare system towards physicians that may be white in certain instances, how have you approached patient interactions so you can kind of show that you're trying to engage in allyship and show that you're really there to support them despite their preconceived notions?
Well, thank you for the question. I think it is probably it's difficult and easy. The way I think about this is I try to be myself. I try to be honest, and that's as Jen mentioned. That's my approach, and that's what I suggest for everybody. And sometimes, yes, when people are anxious or angry for whatever reasons, it's not easy to see beyond that. But then I think that's the next step, is that we need to have time. And this is also very important in medicine. Right now, if you come to a clinic, you have 3 minutes, you have one problem to bring, and that's not how this works. In order to have that trust, you have to be able to talk. And there has been a lot of research actually showing, and this is it seems that in North America, this may be more of an issue for African American or ACB communities or people from these communities, but it's again true for everybody. In order to have a trust for someone, you need to get a bit of a familiarity. You need to know each other. And again, one of the members of the ACB Organ Health said so that before we get to the specific, before we get to the GFR or the kidney function or the potassium, we need to know each other. Because how can you expect me to tell you anything about my life and things that may be concerning without knowing who you are and understanding that, yes, you really want to help me. So I think that luxury of time in healthcare, I think it's probably one important thing towards building this trust. And without that, we can't really go too far. Also, we need to be able to move out from our frameworks, understanding how other people think, and also accepting that there are many ways of knowing. It's not only the medical knowledge is the only one truth. And I'm always trying to emphasize that, yes, we think that living donor transplant is the best treatment. And if you look at Jen, she looks great, she feels great, and that transplant worked well for her. But I have to accept that maybe for some people, this is not the best. And so again, I can go on and on and on. I don't want to steal the time, but it is important to listen, to talk, to have a dialogue, and to have time. And being
Thank you.
honest.
There's a question in the chat. Does the donor have to complete a medical history before?
Yes, that's a very good question. Again, that's how the process starts. So if there is someone who wants to donate a kidney for someone, or sometimes actually you can donate just to anyone, it's called altruistic donation. So the first step is to download the questionnaire, or you get this health questionnaire and submit this to a living donor office in any of the hospitals that do transplants, St. Mike's and UHN in Toronto, Hamilton, Kingston, Ottawa, and London in the province. You have to submit that health questionnaire. It's pretty detailed, as Janin mentioned. It takes quite a bit of time, and there's an awful lot of question about everything. But then, importantly, the donor will have to go through the same testing as the recipient. So the heart function, the lung function is being tested. You have to have a CAT scan. You have to have blood work done. You have to have all kinds of tests. And this is for two reasons mainly. One, to make sure that the kidney that you're donating is strong enough, healthy enough, so that it can support the person and it can provide that 50 or 100% kidney function for the person who gets the kidney, and they can get the most out of it. But also it is important that the whole procedure is safe for you, for the donor, both for yourself to undergo the surgery and also for your long-term outcome, so that the kidney function, your own kidney function, the donor's kidney function remains stable.
Question.
Yes?
What if the donor has a low blood count and they're O blood? Can they
Yeah,
give?
so thank you very much. So as I said, the donor will have to undergo a lot of testing, and sometimes during that testing, things are found, and sometimes those findings can be significant. I just met last night actually someone who wanted to donate their kidney to their nephew, and during the testing, it was found out that he had kidney cancer himself. So his kidney had to be taken out, but of course he couldn't donate that kidney. Sometimes these are not so significant, and it may be that they figure out that certain blood counts or blood work is not quite normal. And there is a separate team who will assess the donor, and their main focus is to make sure the donor is safe. And if there's any health concern, either based on blood work or other testing, then they will say that, sorry, you cannot donate.
Thank you.
Thank you. Now we're a little bit past 7. Do we have any other questions before we wrap up for the evening?
Devon, did you answer that question in the chat already from early?
Yes. Which one was that? I think we've been through all of them.
Oh, maybe that's the one that Dr. Mucsi was answering, if you have to have a complete medical history.
Yeah. Yes, he answers
Okay.
that one.
Okay.
Yes. All right. If no more questions, thank everybody for coming out tonight. I want to thank our speakers, Janine, Dr. Mucsi, Dr. Auguste. Thank you for sharing your insight, your wisdom, your experiences with us. And I hope this has impacted somebody's life tonight in a positive way to learn more about kidney health. I've posted our KHE website, so Kidney Health Education for African, Caribbean, and Black Communities website in the chat. So you can go there to figure out everything that was discussed today is there and in more details. To learn more about kidney disease, you can have it at hand, you can share it around, pass it on to friends, as well as posted a feedback form if you want to share some insights on the presentations tonight, or if you have any additional questions. Thank you again. Would somebody like to close us off in prayer before we go?
Father, we thank you for what was discussed this evening. We thank you for all the presenters. We thank you for Devon for organizing this. We thank you for Janina and her advocacy for kidney donation. We just thank you for all of these knowledgeable persons, Lord. And Father, we pray, dear Lord, that the information that was passed on to us, that we may share it with others as well. Thank you. Please grant us all a good week, we pray. Amen.
Amen. Have a good week, everybody.
Thank you very much.
Thank you. Take care.
Bye-bye.
Bye.